President, CEO, physician. His is a big job. Dr. Esmaeil Porsa runs Harris Health. He is the boss to thousands who provide health care to millions of uninsured and underinsured people. But the one thing he believes that's important about leadership philosophy is something few people at the top would ever say. Harris Health is a safety net, emergency, and medical system to all of Harris County, and you might be surprised to learn how many physicians, maybe even your own, have trained at Harris Health. Hear what Dr. Porsa says about leadership, about who has access to quality health care and who doesn't, and what we can do, any one of us, to help. Let's talk about your breast. A different kind of podcast presented to you by The Rose, a breast center of excellence and a Texas treasure. You're going to hear frank discussions about tough topics, and you're going to learn why knowing about your breast could save your life. Join us as we hear another story and we answer those tough questions that you may have. We are so glad to have you here today, and I don't know that everyone knows what Harris Health is. We used to call it Hospital District. We used to call it Ben-Taub. We still call it Ben-Taub and LBJ. So just give me that big overview of what is Harris Health.
Sure. So Harris Health System is a safety net hospital system for Harris County. We are the largest one in Texas, the fourth largest in the country. You mentioned our hospitals, Ben-Taub Hospital, our adult level 1 trauma center hospital. LBJ is our adult level 3 trauma center hospital. Between the two of them, every year they have about 150,000 ER visits, about 30,000 discharges from the hospital. But what I always emphasize is that Harris Health System is really about the community. And to exemplify that, I mentioned the fact that for our 40 clinics, including some freestanding outpatient surgical centers, outpatient oncology services, last year we had 1.6 million encounters in our outpatient setting. So vastly different than the 30,000 hospital discharges. Just to emphasize the fact that we are really focused on health promotion, disease prevention, and being part of our community.
Well, I know here at The Rose and Dr. Porsa, we've been in this business about the same amount of time. Only you're a lot younger than me. So, but I know how much The Rose has depended on Harris Health for so many of our patients. Once we have them through the whole process and we have a diagnosis of breast cancer, that's when we're looking to Harris Health to help us get them into treatment. So we've always been indebted to Harris Health and have always known that it is overloaded from the get-go. You did not come from Hospital District.
I did.
You did? Okay.
So I actually did my training almost 30 years ago here at Harris Health System as a member of the UT McGovern Medical School. I was a chief medical resident. After that, I worked as a faculty with University of Texas McGovern Medical School, but delivered care inside the Harris County Jail. I actually took care of inmates for 10 years before moving to Dallas in 2007 and joined Parkland Health and Hospital System, which is the safety net hospital for Dallas County. And I was there, did several things before moving back to Houston in my current role, officially on March 2nd, 2020, the week that we had our first COVID patient.
Oh my gosh, I was looking at some of your other statements and podcasts and thinking, I know everyone has asked you that, but how on earth did you manage? I mean, you start this brand new job and then you walk into COVID. It had to be beyond anything, any kind of situation you could have dreamed.
Yeah, definitely unexpected, right? I mean, nobody knew anything about COVID-19. Definitely no one was expecting a global pandemic. And it was interesting because I'd taken a couple of weeks off between my previous job and this role. And I was reading a book called The First 90 Days that was recommended to me, kind of like planning what I'm going to do. And of course, you have to throw it out the window because I started and all of a sudden we were in the middle of the pandemic. But, I say that and I always have to qualify it that, as a physician CEO, the first physician CEO that Harris Health System has had in its 60 years of existence, it really provided an opportunity for me to, in a way, to really rely on what I know best, which is, how to take care of patients and respond in emergencies. I didn't tell you that after my chief medical residency year, I actually was in charge of the LBJ emergency room for a year before I started working in Harris County Jail. So in a way, it was kind of an interesting situation for me to be able to draw on what I know. Obviously, this was my first CEO position. And, another thing that I always talk about is the fact that it forced me to really get to know the other hospital system leaders in this community. There were a couple of hospital CEOs who didn't know what Harris Health System was. I mean, they are hospital CEOs in Harris County, city of Houston, and they were not really sure about what Harris Health System was. They had never met the previous CEO. But again, out of necessity came a lot of positive things.
And I remember you saying that hospitals had to share supplies. I know we were looking for supplies. That was, of course, the number one thing. But you were also treating people who were incredibly ill. Oh my gosh, it was beyond anything healthcare has ever known in my lifetime.
Well, my lifetime too. A lot of people's lifetimes.
Oh yes, and the one thing that I always wonder about. Now, you were at Parkland, and you've been in some other larger areas, but what makes Houston and Harris County different, or is there a difference?
There is, and people, in other venues, people have asked, what makes Harris Health special, and it's kind of like the same question. And to me, it sounds so cliche, but it is so true. There is something different about the people who serve Harris Health System and the city of Houston and Harris County. There's something special about the resilience and the heart of the people who serve this community. If I were to talk about, what is different about Houston and Harris County, and again, this is going to sound, cliche or made up, but it's true. We actually have, and I'm not political, this is not a political statement, but it's a reality. We have a county judge who is really focused on addressing some of the non-medical determinants of health, the social determinants of health. Things like addressing poverty, unemployment, housing. People who may not have lived anywhere else, they may think that, well, that's just what happens everywhere else, but it doesn't. So that I think that really distinguishes City of Houston, Harris County, Harris Health System from anywhere else. And in addition to that, yes, we are home to the largest hospital and health system complex in the world at the Texas Medical Center, but I do have to give credit to the hospital system CEOs in this area that they truly partner. They truly want to be part of the solution, which is not always the case in other municipalities. So that's also special.
So now tell me, what is your philosophy in leading this huge organization?
It's interesting you should ask. Soon after I started working here, of course, we were in the middle of the pandemic and everything else, and people were stressed out, as you can imagine. And I had read a book, and I was thinking about what distinguishes me from the previous leaders at Harris Health System. To your point, what is my philosophy in leadership? And I still remember clearly that I was sending out monthly statements to our employees and medical staff. And, I started rounding the hospitals every Sunday. That I have continued. So every Sunday I walk both hospitals. And I started having a monthly town hall meetings, one at noon and one at 5 a.m. And I've continued to do that since I arrived here. And part of that, one time, one of the statements that I was that I had written, I ended it with, and I felt compelled to say it. I said, I love you, to all of my employees and medical staff. And remember sending that notification to our corporate communication saying, I want to send this out to the system. And, they all came and said, time out, Dr. Porsa, you can't say that. And they actually tried to change that statement. And I remember going back and forth, really struggled with it. Initially I changed the statement and it was really bothering me. And I went back to them. I said, guys, you know what? I want to say this. I feel compelled to say this. This is who I am. So we did. So I said that. And since then, every town hall session, every new employee orientation, which is every 2 weeks, every statement that I send out always ends with, I love you. And I mean it. I truly feel like the Harris Health System employees and medical staff are part of my family. And when I say I love you, I really mean it. So what is my philosophy? We actually started this journey that I'm calling it Leading with Love. And really the whole premise is to provide psychological safety for all of our employees and medical staff so that people can bring their true, genuine self to work, not what you want for the public to view you as, but truly who you are. And I feel empowered and comfortable and confident to express yourself and speak up. So that's my philosophy, leading with love. I want to be known as the love CEO. So there you go.
I have never heard that, ever. Oh my gosh. So did your employees, did they have any pushback? Now I'm talking about the people on the corridors and working and.
Yeah, so that was the amazing thing, right? So it was nothing but positive feedback. So when soon after that, when I started walking the hospitals, nurses would come to me and, they hug me. And, they said, Dr. Porsa, I need a hug today. It's been really positive. So at the end of the new employee orientation, and I love it when it happens organically, when I end by telling, however, 50 or 100 new employees in the auditorium, I tell them I love you. Some of them shout back, we love you too. And that's amazing, right? This is a new employee to Harris Health System. What a great start.
Oh my gosh.
That the CEO tells them, I love you, and they yell back at the CEO, we love you too.
Oh, that just makes me want to cry. It's so special.
It's been very, very special. But thank you for saying that.
I'm very curious about who most influenced you. Who is your hero? When you were growing up, were you always going to be a doctor?
Yeah, so, people, there's like icebreakers, people ask, what did you think you wanted? Just a couple of weeks ago, I was in a workshop and they asked the same question from all the audience, what did you think you were going to be when you were 6 years old? And I always tell people I'm a terrible example of that because as long as I remember, I wanted to be a doctor. I never thought about being anything else. I think one of the earliest memories that I have is me wanted to become a doctor. And I think the reason for that is my mom, all my life, she struggled with her health. She had congestive heart failure. Unfortunately, she lost her life to complications from congestive heart failure. But I remember her being in and out of the hospital and in and out of the doctor's office. And I think it has to be because it just really made me want to be a doctor. And not only that, I wanted to be a doctor who dealt with patients, really. Nothing against radiologists or pathologists or even surgeons, but I really wanted to be close to my patients. So no, I've always wanted to do that. And it's been a blessing that I've been able to work towards that goal and achieve it. And, one of these days when we have maybe more time, I can actually tell you the story of how I ended up in the United States.
Tell us.
Okay. So, I always also ask people, for them to guess where I'm from because I wasn't born in the United States. I was born in Iran and actually migrated to the United States in 1984 after high school. Came here alone, did not speak English, and came here on a student visa and admission for English as a foreign language program to Our Lady of the Lake University, very small Catholic college in San Antonio. And, the story that really what makes it special is that when, so this was 1984, you may know that in 1979, there was a revolution in Iran. And soon after that, the hostages were taken from the U.S. Embassy. So there was no U.S. Embassy in Iran. So for me to get a U.S. visa, I had to travel somewhere else. And it just so happened that I chose to go to Zurich, Switzerland, to go to the American Embassy and get a U.S. visa. The ambassador at the time, the person in charge of issuing visas, interviewed me. And all I had at the time was just my grades from school and my admission paper to Our Lady of the Lake University. And, he's interviewing me through a translator, and he asks the questions, why is a Shiite Muslim, me, going to a Catholic college? And my answer was, what is Catholic? And he started laughing. He realized that
Really?
I was just very, very naive. And he started laughing because, you know what, I think you're okay. So he gave me a visa. So that's how I ended up actually in the United States. And it was just a blessing. All my teachers were nuns. And it was quite a struggle to go through everything and get admitted to the medical school and all that. And that's another long story. But I wanted to make the point that I wanted to be a doctor. Not only that, I wanted to be a doctor in the United States.
In the United States,
and it all worked out with God's blessing.
What an immersion, though, into a whole different world, not just language, but everything. Everything. Oh, my goodness. And you still made it.
Yes, I did.
Yes, you did. All right, talk to us. Let's talk a little bit about what's really going on in Harris County and our uninsured, our underinsured. What would we really need from a healthcare perspective to take care of so many people?
Yeah, so some of it we already have in place. You mentioned the fact that in your organization, people who at some point ended up being diagnosed with breast cancer, that you have the ability to refer them to a Harris Health System and we'll take care of them. And that's true for a lot of other entities who are currently providing health services in Harris County. And we have a lot of them. We have a lot of federally qualified health centers. We have some faith-based clinics, non-faith-based charity clinics. And all of those have created a web of providing services to the unfortunately large number of uninsured and underinsured in Harris County and City of Houston. And somebody asked me, how is the competition with FQHCs? There's no competition. We are partners. Their sweet spot is primary care. They do provide some specialty services, but it is really incumbent on Harris Health System to step up and provide that layer of services, specialty services. But that is not to say that we've got everything covered. Unfortunately, Harris County is the home to the largest percentage and the largest number of uninsured in the country. And, when you consider the fact that, 1 out of 10 people in the city of Houston are undocumented. 1 out of every 4 Houstonian was born outside the United States. People talk about, well, if we just expanded Medicaid, that will solve their problem. It would definitely help. It would definitely help. But even expanding Medicaid, especially as limited and restricted our Medicaid laws are in Texas, the regulations around Medicaid, it would potentially help maybe 20% of the uninsured population in Harris County. So there would still be a large number of folks who would not be able to access care. So what is it going to be? What is needed? I think expansion of our services, not just Harris Health System, but other providers of services. Expansion of Medicaid will go a long way, and also other kind of innovative, outside of the box ways of providing people with coverage. Our Harris Health System, we've been doing this. I can't take credit for this. This has started before I got here. I can only say that I'm supporting it and we're trying to expand the program. We, Harris Health System, are providing, we are paying for the premiums for almost 25,000 Houstonians. So they have access to private health insurance. Obviously,
I think that's brilliant.
Brilliant. And what makes it brilliant is this, if they come to us, that's great, right? We'll take care of them. And now we have somebody who's got a payer source. And that actually, just that portion who comes to us, obviously we have a capacity issue. You mentioned at the top of the hour that we have a huge capacity issue. There are way more patients that need our services that we are able to provide services for. But just the fraction that come to us more than pays for the cost of providing the private health insurance, the premiums for that 25,000 people. Majority of those people actually seek care at other healthcare institutions for non-for-profit or for-profit hospitals. That brings millions of dollars of insurance payments to these hospitals for our community. Now, that is not a direct benefit to Harris Health System, but that is a direct benefit to our community. And we'll take it as a win.
This is one of those, there's no real answer, but in our lifetime, or especially yours, do you think we'll ever really move to a preventive type approach to medicine?
If you mean that like as a culture change, like, the entire system moving towards it, I don't think so. But, I'm also happy to say and believe this to be true, that we are taking steps, not just Harris Health System, but I think the entire country, that everybody is at least talking about the importance of health promotion and disease prevention, not just because of the fact that it is better for our patients, it improves outcomes, it's a better quality, but because at the end of the day, actually, that is the only thing that is going to save us, this entire country, this entire health system, because of our runaway healthcare costs. As long as we pay for volume, as long as we pay for the new gadgets and the new this and that, only meant to, and it really is crazy when you think about it, we spend millions, if not billions of dollars focusing on the last few days, weeks, maybe months of life, really completely missing the boat of realizing that, for a fraction of that cost, if we really move the interventions towards, early childhood and adolescence and early adulthood, if you're able to prevent diseases, if you're able to postpone diseases, how much better the entire society would be because of that, and how much lower the cost of care would be. Those few weeks of life at the end that takes billions of dollars, we would actually add months, if not years, to our longevity. This, and I know I'm preaching to the choir here. The United States spends more per capita and in total number of dollars in our annual healthcare expenditures, and we are not even close to the top of the life expectancy. I think that the country that is on top of the food chain when it comes to life expectancy, Japan, spends less than half per capita and total number of dollars than the United States pays. I mean, there is a reason for that, and I think the reason is clear. Everybody knows it, but unfortunately, the way the system is set up right now, the entire system is incentivized to focus more on, the high-end medical interventions that pays really well. Now, Harris Health System, us, the bad news is that we are a public health system. The good news is that we are a public health system. So every service that we provide is an additional cost to us, right? We don't provide services because we receive revenue. So it actually makes sense for us. If we know we have X number of dollars, if we are incentivized to actually focus more on disease prevention and health promotion, we can serve more people with the number of dollars that we have. So to answer your question, in my lifetime, yes, I think I'm already seeing the movement towards disease prevention and health promotion. Do I think we're going to get to the level of some of the more progressive, Western countries? Probably not, but there's hope.
There's hope. Yes, absolutely. Talk to us about why the expansion of LBJ is so important.
Since you brought it up, let me talk to the folks who are listening. You know, Harris Health System has requested, and the Commissioner's Court has approved, a $2.5 billion bond proposal for the November 7th. A couple of interesting facts. This is the first time in the history of Harris Health System in the 60 years that Harris Health System is going to the public for a bond proposal, which when I first learned that, it really blew my mind, because as a public health system, that should not happen, right? I mean, when you think about the other municipalities, Dallas, El Paso, San Antonio, Burke County, you know, every 10, 15 years, they go to the public for a bond referendum because they invest that in the infrastructure. But Harris Health System has never done that. So part of that infrastructure expansion, like you mentioned, is the new Level 1 Trauma Center hospital on the LBJ campus. Why a Level 1 Trauma Center? Because this county desperately needs more Level 1 trauma facilities. We currently have 2 of them, both of them in the Texas Medical Center, attached to one another. Basically, one large Level 1 trauma center for the entire county. So outside of the Texas Medical Center, north, east, west, south, no matter where you are, if you're a victim of a severe motor vehicle accident, if you're a victim of a gunshot wound or stabbing wound, you have to be driven or flown into the Texas Medical Center to receive that care. The future hospital on the LBJ campus will not only expand the capacity of that hospital to twice what it is today, but it will be able to provide Level 1 trauma services for the northeast corridor of Harris County, and actually north and northeast Harris County, because it will be a lot closer than the Texas Medical Center. And you know, why LBJ Hospital? Why that campus? Because, like I just mentioned, it is the only hospital serving the entire northeast corridor of Harris County. There is a large population that requires those services. In addition to that, unfortunately, there is a large population of uninsured and underinsured. Currently, and as we have looked into the future, as part of our strategic plan, that number seems to only go up. So it really makes sense for that facility to remain on that campus, but of course with increased capacity and capabilities, and that's the reason.
And you're actually going to continue services while you're building. Is that what I understood?
That is correct, and actually that's one of the other reasons, you know, why LBJ campus, because we are blessed to have enough land, enough property on that campus that we can build a new hospital while the current hospital continues to function. So everything goes well. We build a new hospital. We open its doors in 2028. The idea is that we move all operations from the current LBJ hospital to the new hospital, and then we can refurbish the existing LBJ hospital into providing some of the services we currently don't have, such as inpatient psychiatric care, emergency psychiatric care, and outpatient psychiatric care, long-term rehab, things that we currently do not have and things that our patients and this community desperately needs.
You know, you see so many campaigns about let's add this, let's add that. You're talking about people's lives, and this. I'm not sure that our listeners always understand what capacity means, and not having that capacity. Can you put it into something that we can get our arms around?
Yeah, I'm happy to. And, you know, actually, I've brought this up a couple of times at the Commissioner's Court. And the examples that I've used is this, you know, like LBJ Hospital has 80 or just maybe a little more than 80 rooms or hospital days to take care of folks in the emergency room. Every morning when I listen to our morning huddle, they say that there are 30, 40, sometimes 50 patients waiting for a hospital bed in the emergency room. So almost half of the total capacity of the emergency room every morning is already taken up by people who have already been admitted to the hospital, but there is no hospital bed for them to go to. And then when it gets really tough, when, you know, push comes to shove and, you know, everything backs up into our emergency rooms, out of necessity, we actually take people on stretchers upstairs to the hospital, but because there is no hospital rooms to put them in, we put them in the hallways of the hospitals. That should not be happening. That should not be happening anywhere. That should not be happening in Houston, Texas. In this day and age, again, home to the largest hospital complex in the world. So having patients in the hallways, having patients boarding for sometimes days in the emergency room should not be happening. In addition to that, then it's not just capacity, but also capabilities. Even today, somebody walks into our emergency room at the LBJ hospital with a heart attack or stroke. All we can do is to stabilize them and transfer them out because we are not able to provide those services. We do not have the capabilities nor the space to do that. Somebody asked me recently, why don't you just build on top of the LBJ hospital? It's not that easy. When the hospital was built 30 some years ago, unfortunately, there was no thought into, what would happen, if we need more capacity and can we build on it. It doesn't work like that. We looked into it. And it would actually two things. One, as soon as you start doing some construction inside the existing LBJ hospital, you have to bring it up to today's codes, which would dramatically reduce the capacity of the hospital. LBJ hospital, unfortunately, even today, has double occupancy rooms. You have 2 patients to every room. Well, that's not code. That's against today's code. And I'm glad it is. If we didn't learn anything else from COVID, is that is not a good idea. So if we were to do anything to the LBJ hospital, all of a sudden we would lose half of the capacity, which would be just a disaster. So I'm glad you asked that question. So yeah, it's just more than just capacity. It's also capability.
Right. And I do understand that. We are in a 40-year-old building, and every time I talk about renovation, it's like, no, you can't do that. You don't know what you're up against here. And I'm starting to really understand it. So thank you so much for giving us this really inside look at what's going on there and why it is so important that we support it. I mean, this is part of our community. It is about taking care of our community, and it's about building a healthier, more resilient. I can't even come up with the right descriptions of what this will mean. Because of what we do. The only, and this is a horrible statistic, but it is one that I see every year. For the last 7-8 years, the only stage 4 breast cancer that we have diagnosed has been in uninsured women. We take care of, twice as many insured as we do uninsured, and still, that's the only group that has it. I mean, whenever people say, oh, what's all this diversity stuff? What's all this health inequities about? I just say that should not be happening.
You really hit the nail on the head. That's exactly right. And, and people argue, well, what does that have to do with me? It has everything to do with all of us. This is not about the indigent. This is not about just the uninsured. The fact of the matter is that, the others, that some people think of them. Those are the people who are in our everyday life. Those are the people who are in our groceries, in our gas stations, in our mechanic shops. They are everywhere. These are the people who are the foundation of Harris County's economy. If we don't take care of them, the entire economy collapses. And it's just the fact. And people just need to understand it. And the other thing, really important, folks talk about, so why does it matter that, so Harris Health doesn't have enough capacity? We are more than just a place where the indigent receive care. As part of being a trauma center, we take care of the entire Harris County instead of Houston. In addition to that, really important, we are the major training site for our medical schools, UT McGovern Medical School and Baylor College of Medicine. When I have presented to different groups and I ask them, how many of you received your care at Harris Health System? A few hands go up. But I tell them, I am willing to bet that if you were to ask your doctors, no matter where you're receiving your care, where they received their training, at least half of them received their training at Harris Health System. Currently, almost half of all the doctors who are licensed to practice medicine in Harris County receive their training at Harris Health System. So just because you don't come to one of our clinics or go to one of our hospitals, it doesn't mean that you are not receiving direct services. Chances are your doctor is trained at Harris Health System.
And one of the things that I have seen over all these years, many of our patients went to Ben Taub, Harris Health for their treatment. Those same doctors that took care of our patients 30 years ago are the ones who today will take one of our patients, even within their private practice. They understand. I mean, it is not, at one point, our physician network had about 500 physicians in it, and people would say, how do you do that? And I'd say, we just ask, and these are the same people that helped us back when. So you're absolutely right. And, I know you're coming from that medical excellence, but I'm also coming from folks just don't realize how important that is to understand what really happens in the community. You know, we do no longer can live in this isolated solo type world anymore. It just doesn't work. And they get it. They really get it. So yes, that's quite a great way to look at it. You're getting care from someone who was trained there. Well, I'm about to close this up, but I want to ask you one more question, unless there's anything else that you want to share with our listeners.
No, go ahead.
All right. It's 50 years after your death.
Okay.
If you were to come back, what do you hope is still here that reflects something you did? What part of you would you want to see here?
Well, going back to your earlier question, I really would like to see that the focus that I'm trying to bring to really shifting our attention away from being almost to a fault hospital-centric and becoming more and more engaged with our community. I really hope that continues to grow to a point where, when people talk about Harris Health System, the first thing that comes to their mind is not Bentop Hospital or LBJ Hospital. It's really our role in the community. And potentially not just necessarily, health promotion and disease prevention, but perhaps other things that we know are really important in maintaining the health of our community. That's on the health system. And I really like to think that, 50 years from now, Harris Health System is known across the country as the system of love. I always make this comment that a few months ago, you mentioned all these new hospitals and structures going up, and there was a comment made about a recent hospital construction saying that this is going to be the smartest hospital ever created. And the comment that I made is that I'd really like for us to be able to say that when the new hospital in the LBJ campus or when the replacement Bentop Hospital is created, what I would really like to hear is that it is the kindest hospital ever created. I would love to be known for that, for Harris Health System to have that reputation, the kindest hospital system.
The kindest hospital system. That is a great close. That is what we wish for our community also. And we certainly know that this community is going to step up to the plate and do what we need to do come November.
I certainly hope so.
Thank you so much for being with us today.
It's been a pleasure. Thank you.
So that wraps it up for today. And don't forget, we're doing an episode every single day. You're going to get your daily dose of Let's Talk About Your Breasts during the month of October.
October is the month of pink, and for The Rose, a breast center of excellence, that means we'll be airing podcasts every day in October to celebrate Breast Cancer Awareness Month. You'll be hearing from longtime firefighter, senior captain, and breast cancer survivor from the Houston Fire Department. You'll hear how making clay heads was part of her treatment. Be sure to share with family and friends because there's a little something for everyone. To find out ways to help The Rose, visit our website at therose.org. And remember, self-care is not selfish, it's essential.